One of the more common problems that we see here at the Ankle and Foot Center of Georgia is heel pain. It's one of the things that plagues people on a daily basis. Unfortunately, a lot of times when folks have pain in their feet, they think, well, the feet are going to hurt because I'm on them all day long. But the truth is, healthy feet shouldn't hurt. Heel pain most often presents itself as pain first thing in the morning, that once you get up and get moving gets a little bit better, but with a longer time that you're on your feet, the pain returns. When we look at a simple foot model, there's a ligament on the bottom of your foot referred to as your plantar fascia. It attaches to the bones out in the front part of the foot and actually runs back and hooks into the heel bone. If you'll imagine for just a moment, it actually acts as a rubber band type structure to help support the arch of the foot. Every time you take a step, your foot flattens a little bit, and that's how our body naturally absorbs shock as we walk. So this ligament's designed to give a little bit. However, with overuse, and this is an overuse injury, that ligament sometimes can get pulled beyond its limits and it can become torn. Not typically ruptured, but just torn on a microscopic level. Whenever we're resting at night and our foot gets into a relaxed position, that ligament tries to repair itself, and it does that with scar tissue. Scar tissue by nature naturally contracts, draws up, and gets tight when it's healing. When you step down first thing in the morning, that scar tissue needs to be about 6 weeks old in order to hold you. Obviously it's not. It's just a few hours old. So the first few steps hurt so bad because you're literally tearing all the scar tissue back apart. Once you get up and get moving, it feels a little bit better. Stay on it too long during the day and it can start hurting more again because you're tearing the ligament more. Well, it draws up at night and you tear it in the day, and draws up at night and you tear it in the day. This keeps going on and on and on. That's why this is something that goes on for months at a time. The first initial thing we do to talk about treating this is getting better support in our shoe. If we can support the arch better and stop the foot from flattening, we stop that ligament from being stretched and pulled quite so much. Part 2 of treating is aggressive stretching exercises. We give the patients exercises for stretching their plantar fascial ligament, but also the muscles in the back of their leg, because these are directly connected to each other. Anti-inflammatories, sometimes injections of corticosteroids, sometimes referral to physical therapy, sometimes prescription orthotics. 99% of the time, folks can get better without having to discuss any type of surgical intervention. However, sometimes it is something that does become necessary. There are multiple ways to address this surgically. Sometimes we actually go in and cut and release the ligament. There are other treatments out there such as extracorporeal shockwave therapy, which again is an outpatient procedure but doesn't require an incision or anything to get over it. Most of the surgical options have about an 85% success rate. That's why we try as much as possible to get people over this with conservative care. But if you're suffering from heel pain, certainly don't suffer. It's a good idea to get it treated. The longer you postpone the treatment, the longer it takes to get over this problem.
When you're coming to physical therapy centers in Georgia for plantar fasciitis, you're not just going to come in and be put on some machine. There's a lot of manual work that we do in order to help loosen up your muscles, to break up scar tissue, improve blood flow. We're able to use certain modalities as ultrasound, electric stimulation, but in fairness, there's going to be some exercise involved too. There's going to be some stretching, there's going to be some strengthening. There may even be ways that we can give your foot more support to take your pain away pretty quickly. In fact, we can even introduce medication into your foot without an injection and without it entering your bloodstream. We have a lot of unique modalities and procedures that we can use in physical therapy to help your plantar fasciitis.